Hi, I'm Tony Barchetti in San Antonio, Texas with Alamo Slim Clinic. I wanted today to make a video and talk a little bit about these new medicines that have taken over the world by storm, especially here in America, called GLP-1 medicines. What is GLP-1s? The GLP stands for glucagon-like proteins, and everybody's using them to lose weight now. And it's become all the rage because 2 years ago, the FDA approved these medicines to be used for weight loss. They've been around for a long time in treatment for diabetes. And during the time they were used for diabetes, doctors were noticing all of their patients were losing a lot of weight in addition to regulating their insulin and blood sugar. It had this side benefit of losing weight. So they started to do research with the FDA and a lot of clinical trials and big pharma companies to see, can we prescribe these medicines for weight loss, or do we have to wait till patients become diabetic in order to prescribe them? And after a lot of clinical trials, the answer came back, it's totally safe to prescribe them. 2 years ago, the FDA approved them for weight loss only. So doctors can prescribe them without you being diabetic. Now, insurance companies may not want to pay for them, but doctors can prescribe it now. The most popular medicine is called Semaglutide. There are famous brand names out there of Wegovy, Ozempic, but the real drug name is called Semaglutide. The other most popular one is called Tirzepatide, and the brand names for that everyone is learning about are Mounjaro and Zepbound. The brand names are obviously quite expensive if your insurance company is paying for them due to diabetes. Nobody cares how expensive they are. But if you want to lose weight, these medicines are really good, but your insurance company is most likely not going to pay for them. So most doctors are recommending their patients find clinics like ours that can prescribe the compounded semaglutide and tirzepatide that are the generic versions of those medicines, and they're a lot more affordable than the counterparts. Now, how do these drugs work? Why do they help you lose weight? There's a couple things going on here, but I'm going to touch on the highlights. Number one, these are glucagon-like proteins, as I said. Our bodies naturally make these proteins. We're going to call them hormones for the lack of a better word. When we eat a lot, you have these proteins and hormones automatically secreted by our gut. Those secretions trigger a receptor in our brain that says, hey, you've eaten enough, you're full, stop eating. They do this, it's nature's way of making sure we don't eat ourselves to death. The problem is sometimes our bodies get out of kilter and we don't release enough of these hormones. And as we get older, they certainly don't seem to be releasing enough. And the amount that they do release is burned off very quickly in our bodies. So Big Pharma has found a way to mimic these hormones. And that's what semaglutide and tirzepatide are doing. They're mimicking the natural hormone that we are supposed to be releasing, but they add some slow release molecules in so that they don't burn off so quickly. So these medicines require you to come in and get weekly injections. The weekly injections we're trying to target and predict how much you need to inject under your skin. It's called a subcutaneous injection. We're not going into the muscle. It's just under the skin. And how much we need to inject to last 7 days to quell your appetite, make you feel full. The medicine also slows down gastric emptying. Better term for that, it slows down your digestive system so that when you eat, it takes longer to digest. You stay full longer. The other thing it does is it makes you full faster. So when you can eat a small portion, half or a third of what you normally eat, and you'll feel very full and satiated so that you don't need to eat large portions. The bottom line then is that you're going to eat less calories per day, less calories per week, less calories per month. And by simple math, you're going to lose weight. The clinical studies all came back. They're well documented on Google that semaglutide, the patients, after being on the medicines for about a year average, lost 15% of their body weight. So for a 200-pound person, that's around 30 pounds. Of course, some people lose more than the average, and some people lose less than the average, but that's the average of all the studies. Tirzepatide worked a little better. The average weight loss for those patients were 20%. Everything comes with a price in life. Tirzepatide works slightly better, but it costs a lot more. Those are decisions we can talk about further in the clinic, but that's the brief explanation of what these drugs are, how they work, and they have many benefits. Everyone's looking for the weight loss, but when you lose weight, your cholesterol's coming down, your blood pressure's coming down. They found your cravings for not only food are significantly reduced, people lose a lot of their addictions on this medicine. They quit smoking, they quit drinking. It sounds like a cure-all, but through the studies, they really found that people's addictions really were quelled. I have one lady that came in the clinic. I told her this. She didn't believe me. She still wanted to have her wine, asked if it would contradict with this medicine. I said, no, you can still have your one glass of wine with dinner that she liked to have. She came in 2 weeks later and she said, I don't even want my wine anymore. What's that about? I said, all your cravings kind of disappear on this medicine. And she was just amazed. So come on into the clinic or give us a call. And let's see if it's right for you, but it has a lot of good qualities to improving your health in addition to helping you lose your weight. Thanks for tuning in. Until next time, take care.